Hello and welcome to the OB Faculty Clinical Navigation page. This video is to review the stations for OB Simulation Day 1. What we have here is all of the information on which stations we will be doing. We're going through a laboring patient with a cord prolapse in a high fidelity simulation, a newborn escape room station, and a labor escape room station. This is the student instructions, what they're expected to complete before simulation, during simulation, and after simulation. First, we'll start with reviewing the newborn escape room. This station requires that we have the iPads out and that the newborns be set for baby get infected is the patient's name. These are programmed into the SimPad, so all you have to do is to select the profile under the SimPad. Here's the needs assessment, an overview of the experience, as well as how the schedule runs for the day with the AM cohort times and the PM cohort times. We have our objectives and our SLOs, how we expect track prac to be graded, and then the rubric that you have to grade is the infant assessment assignment. Again, we have the information on what pre-work has to be done by the students, and then what their expectations are. You need to click on this overview of the station with the newborn answer key, and then this is the link for the escape room that you can program into the iPad. You can give the link to the student as well if they're having some issue with link not working. These are the technical skills you need. You have to be able to navigate the course point, track prac, Canvas rubric, and then the low fidelity babies. We also have our pre and post simulation expectations for faculty. During simulation, of course, to please communicate any NIs or Us, followed by the lab management, turning off the mannequins, and then Canvas, track prac. I did want to show you to click on this link, and this will take you to the form where you can leave feedback, so that if you have feedback for a station where you're not doing the final grading, you can leave it there, and the faculty that does the final assessment can take your notes and bring them forward. Okay, so let's go to the overview of the escape room. Here again is the link. There is a manual that is printed out with all of these documents that will be available for you at each station. We want to have you remind the students not to use uppercase in the fill-in-the-blank questions. You are asked to demonstrate how we check the bands between the mother and the baby. And then we want the students to be actively working their assessment form and documenting the results as they're moving through the scenario. The mannequins that we're using, we do an orientation to for the students because some of the mannequins we can't take the stoma out. So you just need to let them know there is no stoma. And then, of course, there will be QR codes on the babies that demonstrate Mongolian spots or the stork bite, so they have to scan those. This shows you what supplies you'll need and the scenario. Each escape room is Google Forms, and here are all the answers for every single question. So feel free to go through this at your leisure. What you'll notice too is that when we open up the window, this document is an extra pop-out. So if you just close it, it will take you back. And then again, here's the baby escape room, which is the Google Forms link that you can see. And this is what the students will see. And they have to answer the questions. Now, the Google Forms is not intelligent. So if you clicked all of them, even though all the answers are not correct, it will not tell them that they've overchecked the select all that apply, but it will tell them if they are missing one. Remember, please enter the number only, make sure that they're following the instructions, and then it links them into YouTube so that they can see the assessment from the baby.
There actually isn't a single email that I've written over the last few months without the help of Grammarly. Grammarly.
So for that question, it provides the sound of grunting.
Infant distress means your baby is having difficulties. Knowing what to look for will help you know if your baby is in distress.
After they hear the lung sounds, then they can tell if their lung sounds are moist or clear. Remember, no uppercase, only lowercase text. Okay, and then they'll click next and move through all the pages. And that is all that is to this station. So what we will do is hit the back button. And here is your normal labor admit escape room. So the same principle, same framework and format. Needs assessment, overview, objectives, course competencies, track prac, what work the students did. We did go through a full Alaris pump programming of Pitocin and magnesium during their lab, but if they get stuck, they also have this video available to them as well. We also ask them to review pronouns. This scenario is a non-gender conforming patient with a community-based doula. Then here is the same framework of an overview of the station with the form link and all of the answers to the questions, including the scenario and setup. I will go ahead and click on the link so that you can see this one. What's fun about this particular station is that it does have order sets available in it. Okay, and this should take us forward. Okay, they receive positive feedback anytime that they get the question correct. They have to guess the number of weeks, and then here is their order set. You will have this printed out and available in your driver manual. And yes, her name is I'ma Get Infected. What they'll recognize there is that they are missing a GBS treatment order, and they will need to ask for antibiotics and provide you the SBAR. Once you give them the go that their SBAR was effective, then they can click on I provided an effective ISBARR. Introduction is the I, and the last R is the readback. If they were missing components and they click on that and try to click next, it will say, uh-oh, please read your orders, and then go back and it provides them the orders again. Once they provide to you an effective SBAR, you click the next button and it takes them on to the next set of orders and expectations. In this scenario, they will start an IV, they will put in a Foley, and they will draw labs. You are okay to help them if they're having trouble drawing the labs off of the IV start. So I'll go ahead and click the back button. And our final station is our GBS positive with a cord prolapse high fidelity simulation station. If you just notice that you need to log in and you scroll all the way to the bottom, often you'll find a little button that says authorize. And if you just click that button, it will open it up. Again, it's also helpful too that your Phoenix College email profile is up, otherwise it will ask you to ask for access. All right, so again, this is the high fidelity station. Again, set up in the same framework. What you'll see here now is that we do have the case overviews from the Ricky book and VSIM. In this scenario, we asked them to complete the pretest before 48 hours before SIM, so we do ask that you review that if you are assigned to the station. And it does give you your SBAR and all the information that you need for the scenario. Here is the faculty driver manual, which kind of takes you through every single step, including the setup, how you brief the students, all the student team actions that we expect, as well as how to, coach them for the debrief. We also have the debriefing questions here. We ask that you pick only one based on what the issue was that you identified as an area of opportunity. And that will kind of support your process for debriefing. Okay. And then here is the DocuCare documentation. We are expecting that they only document what's listed here. We're not asking them to treat this, 60-minute simulation like a patient they've been caring for 12 hours. So these are the only things that we need them documented. Again, you will only document on the last set of students, and I'll go ahead and show you that in just a moment. Okay, so we'll hit the back button again. If ever, oh, there it is. If you click on the start button again and you go all the way back, you will be able to see which station you're assigned to. And that is listed here. Faculty, 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 and you are documenting only on the last set of students. Okay? Again, as a gentle reminder, we also have this clinical notes for TrackPrac, where you can put in any notes for whoever is the last person to assess them for the day. It is required if you are working the GBS Core Prolapse scenario that you confirm that the pre and post test is done by all students. But again, you are submitting the TrackPrac on the last student. You also have to check the documentation for each student, just like the grading for the labor assessment station is self-reflection, and the grading for the newborn norms form is the person doing the newborn norms station. Okay, and then each clinical day we shift in who does what and split up the grading so that it's equitable. If you have any questions, I am facilitating for the AM cohort, and Shalise will be facilitating for the PM cohort. If you're curious where we are in the semester, you can also click these calendars, and that will tell you what information we are covering currently, what exams, and so on and so forth. All right, thank you so much for watching this video, and again, please give us a call or send us an email if you have any questions. Have a great day.